We were really excited about the fact that the National Rural Health Association was coming to Anchorage. Literally, we were going to have hundreds of rural health care providers and policymakers here in Anchorage in May of 2007.
We wanted for them to see firsthand life in rural Alaska and our unusual rural health care systems. There's a difference between hearing about rural Alaska, reading about it in a report, and sitting in a twin-engine plane as it touches a village's gravel runway.
So we created one-day trips out into some of the most remote locations so that our visitors could experience firsthand what it was like to provide health care in those rural communities, to have a real healthcare Alaska experience.
Over 150 conference registrants participated in subsidized day trips. Everyone visited at least 2 communities. 27 communities received guests. The purpose of this DVD is to tell the story of their experience.
I've been telling everyone who will listen how wonderful this experience was, to meet the healthcare workers, to see their pride, and to understand what barriers they have overcome to provide care to their communities. I paid for this trip out of my own pocket, but feel as though it was worth much more than I paid, and would have paid whatever, now that I know what a once-in-a-lifetime experience this was. Everybody we met was willing to help out where needed. The employees were all very unselfish and felt that their purpose was to help the patient. I wish more healthcare systems acted the same way.
I think the most profound lesson I took away from this experience was the sheer gutsiness and courage of the community health aides. Their willingness to step forward and serve their remote communities with a minimum of training is incredibly selfless and special. As an RN who has worked many nights feeling I was on my own, when I actually had physicians and surgeons quickly available, I stand in awe of them.
The remoteness, small numbers, and economic vulnerability of the village were countered by the openness, warmth, generosity, and beauty of the spirit of the people. I was very touched by their sincerity and commitment to preserving their village and traditional way of life. I know this experience will continue to challenge me and impact the way I look at other peoples that are different from the mainstream.
Alaska is an enormous area, and we observed only a very small portion of the healthcare system. I feel we received a better understanding of the healthcare environment and system in the areas we visited than if we hadn't been there. It's something you can't just read in a book or tell someone about.
One thing that left a lasting impression on me beyond the flexibility of everyone we met was their enthusiasm and care for their community. Everyone we met in Alaska was so very proud of the country, the people, the values, a true lesson for us in the lower 48. I was pleased with the knowledge I obtained and in fact a new vocabulary. Subsistence culture is not a term I was familiar with prior to this experience. I learned not only about the economy, but also a lot about healthcare delivery in remote Alaska. It was a wonderful experience, one that I will never forget.
I'm so honored that someone took the time to educate those of us uneducated about community health as it is in Alaska. It's well worth the time of the sponsors, volunteers, advocates, organizers, and everyone involved to teach us about their health and education challenges. If we thought we had demographic challenges in our rural areas of the country, stop and consider Alaska. Anyone who was on these Alaska experience trips will never be able to look at the world the same and healthcare in the same way. When any of us serve on advisory boards, review grant proposals, serve in consultancy capacities, or related positions, we will have a little better understanding of the challenges in delivering healthcare in Alaska, and perhaps, to at least a small extent, be an advocate for these Alaskan villages.